Well, thank you. I think we cannot help but be impressed by the nature of this gathering. Walt and I have had our experience with fundraising dinners, and we know what is involved in putting them together. I don't remember ever having been to one that had a spirit like Tish showed us tonight. I think she may have set a new standard for all of us to follow. We're really honored that you would include us in this celebration as you have, acknowledging the pioneering work of our forebears. I must say it is especially meaningful, to me at least, that this recognition comes from a fellow psychiatric facility. Not that we're all that competitive, but we don't necessarily lean over backwards to be good to our colleagues. But you have, and I must say I appreciate that. In anticipation of the move to Houston, our organization made an effort in the early 90s to identify some essential elements of the treatment, partly because we regarded it as unique, not anything like it anywhere. And we thought it was important to try to identify those elements that distinguished it, ideally ones that could be taken with the group when they left. Elements that didn't depend on the benefits of the serenity and beauty of our West Campus or on the extended lengths of stay that were then possible but simply no longer feasible. And I want to touch briefly on 4 of them because they struck me as central to the work and really the essence of what I think is our uniqueness. The first is the central role of a therapeutic team. And we're all fond of talking about teams, and it's almost a shibboleth. We all believe in it. It's like motherhood and God and all those other things. The fact is that it is too seldom practiced. Many of us are too isolated in our own silos, busy working away what we think is important. And if our neighbor happens to be doing something similar that's neat, we'll be the last to hear, I'm afraid. But at the foundation, this collaborative, multidisciplinary group focused on comprehensive diagnostic and treatment processes for each one of the troubled persons who came to us for help. And this is something a good deal more substantial than enumerating symptoms and pushing pills. The strategy also acknowledged the fact that successful treatment, especially in the hospital setting, requires an integrated efforts of a team. It is not the job of a single individual. And the second, establishing a vigorous intellectual environment that emphasized the importance of learning and teaching for and by everyone on the staff. The teachers were not simply experts, though many were, but also individual staff members who taught and learned from each other, and especially from their patients. The patients' problems pushed us to seek therapeutic solutions, and their efforts to deal with these problems helped us understand better the nature of mental disorder. This emphasis on extending and sharing knowledge and broadened understanding generated a very stimulating environment that enhanced the effectiveness, and I think it made our clinic a great place to work. It is a quality about which I think not enough can be said. Sometimes we assume that the learning concluded pretty much when we had our degree and finally didn't have to take exams anymore, failing to recognize that some of the wisest things that any of us ever learn are from our colleagues and our patients, and not necessarily from our colleges. The third is the significant role of groups. We all live in groups, we work in groups, we eat in groups, we do all kinds of things in groups, but not often do we pause long enough to take a look at what they are and how they work. And discovering the therapeutic effectiveness of groups, along with the development of the treatment team that I just mentioned, brought a recognition of the value of group psychotherapy and led to its extension. Further, the organization's utilization of group dynamics and group processes actually made a material contribution to the management of the organization. The fourth and final is the deep commitment to shared values of hope, caring, mutual respect, and dedication. These values characterize the attitudes and philosophies of Dr. C.F., Dr. Carl, and Dr. Will, and they reflected the spiritual basis of their work, and subsequently ours. Work that enhanced a basic philosophy of respect for fellow human beings, a perspective that was present at the beginning and is present still. This perception of the worth of others was also evident in the relationship between the organization and the employees. It expressed the view that effective caretaking is isomorphic. What's good for the staff is good for the patients, and what's good for both is good for the organization. It is literally a mutually reinforcing system. Staff members who feel valued and respected by the organization that they work for will be more compassionate caretakers, and they'll be more effective treaters. I think these four elements are an important part of successful psychiatric treatment wherever it's conducted, not simply in an inpatient system as ours was, but as outpatient settings such as this one. And I'm aware that you already know this. If I didn't know that before tonight, that at least I've had reaffirmed. And I notice that you practice it well. I'm also pleased to note that these elements remain a part of the legacy of the Menninger Clinic in Houston. I think they lost something when they didn't take a little Kansas soil with them. But that's what memories are for. It's a source of considerable satisfaction to see examples of these concepts, four that I've mentioned and others, persist and grow, notwithstanding the current diminished commitment to the support of mental health. Thank you for this opportunity to talk a bit about the Menninger Foundation, and especially for the recognition that you have given us. We're very proud to accept it. Thank you.